High frequency ventilation is an advanced mode of mechanical ventilation that uses small tidal volumes, often less than anatomical dead space, and extremely rapid ventilator rates. In this video, we shall see and learn the care of a neonate while on high frequency ventilation. The indications include failure of conventional ventilation, pulmonary air leak, pulmonary hypoplasia, PPHN, and when the conventional ventilation fails. Equipment, personnel or baby required. Baby on high frequency ventilation, SLE 5000 or SOFI ventilator. Patient component of SOFI, humidification chamber and ventilator tubings. Choose HFO ventilation mode, either CPAP or IMV. Ensure that humidification bottle is filled with water and the heating system is on as seen in the main drop down menu in computer screen. Close the safety valve which is present on the right side of the ventilator with HFO sealing cap. Choose required inspiratory proportion from 33 to 50%, roughly from 1:2 or 1:1 ratio. The ventilator has a system of monitoring mean flow during HFO ventilation. If the mean flow shows a marked positive increase above the already set basal flow rate, endotracheal tube leak or disconnection needs to be ruled out. In these cases, the alarm flow limit disc is activated on the screen. The setting to be set include frequency, mean airway pressure, amplitude and fractional inspired oxygen concentration as displayed. With the initiation of HFO ventilation, there is continuous and equal vibration in the chest from the nipple line to umbilicus in neonates and from clavicle to hips in pediatric age group, known as chest wiggle factor. Family member should be communicated about the management of the baby. Assess vitals by multi-channel monitor continuously. Check capillary refill, skin color, temperature, blood pressure and oxygen saturations. Continuously monitor and assess the depth of chest wiggle factor. A decrease in wiggle may suggest tube block. Increase in wiggle at the same amplitude suggests an improvement in the compliance of the lung. A presence of asymmetrical wiggle as when compared with both sides of the chest may indicate pneumothorax or tube block. Vibration mainly in the neck could indicate a dislodged ET tube. Listen the breath sounds in infants ventilated on HFO ventilation, as the sounds, which are friction sounds, may become reduced in the affected side when ET tube is low and ventilates only one lung or when pneumothorax is present. Two nurses are required to reposition the baby. Check for chest wiggle, SpO2, endotracheal tube placement after repositioning. Reposition carefully. Ensure a smooth interface which is free of kinks between the endotracheal tube and oscillator circuit. Document the amplitude, FiO2, MAP and frequency and auscultation assessment. Check for humidification of the ventilator regularly, as improper humidification is associated with repeated tube blocks and can result in necrotizing tracheobronchitis. Be vigilant on monitoring clinical signs of deterioration by looking at chest wiggle, blood pressure and saturation. Avoid ET suction for the first 24 hours unless necessary, and it is to be done only if there is evidence of tube block such as desaturation or decrease in wiggle of the chest. Watch for any desaturation noticed soon after suction and record action taken for the same, such as an increase in MAP or FiO2. Be prepared for a potential drop in blood pressure which can occur due to increased intrathoracic pressure. Volume expanders and or inotropes should be ready. Some do's and don'ts. Avoid disconnection from the ventilator as much as possible during repositioning or change of linen as this can cause alveolar collapse and loss of lung volume. Perform ET suction judiciously. Suction is to be done if there is evidence of tube block. Proper humidification of gases. Nurse should keep a vigilant watch for level of wiggle, any change in wiggle, humidification, last suction done and last desaturation. The monitoring includes evaluation of ventilator settings and chest wiggle in addition to important vital parameters as displayed.